Infertility and Contraception. Chapter 8, Part 3. So, infertility is an inability of a person, plant, or animal to reproduce by natural means. In humans, inability to become pregnant or carry it for full term. For demographers, it is childlessness for a woman in her reproductive age. By the WHO, it means failure to achieve clinical pregnancy after 12 months of natural sex. Statistics for worldwide, 5% of couples have unresolved fertility. For female, age 24 is peak, 30 would be diminishing, but for men, age is 25 for a peak and it starts to diminish after 40. Causes 20-30% due to male infertility, 20-35% due to female infertility, 25-40% both factors. The highest infertility, Eastern Europe, North Africa, the Middle East, Oceania, and Sub-Saharan Africa. The lowest infertility, South Korea and South America. Primary infertility means absence of live birth to a woman who desires a child, have been in union for at least 2 months with no contraceptive, and hasn't given birth for the first time yet. Secondary means absence of live birth to a woman who desires a child after her last live birth, have been in union for at least 2 months with no contraceptive. Effects of infertility: depression, either husband or wife. Women who are depressed due to infertility have stress similar to heart disease and cancer sufferers. Marital arguments, domestic violence, sexual dysfunction due to anxiety, cultural stigma, being alienated or rejected by peers. Older people with adult children live longer compared to the childless. General causes of infertility for both sexes: STDs, immune infertility, genetic diseases, and environment. STDs are sexually transmitted diseases, which are infections such as chlamydia and gonorrhea in the female reproductive tract, which causes scarring, which causes inability for the zygote to implant. Immunity: 10% or 30% of infertility couples have anti-sperm antibodies. It interferes with sperm activity, usually caused by infection, rape, or unprotected sex. Genetic: some people are born with the Robertsonian translocation, which causes abortion and infertility. NR5A1 gene in men causes low sperm count. Diseases: diabetes mellitus, thyroid disorders, adrenal disease will cause imbalanced hormones. Environment such as smoking will cause DNA damage and cancer. Glue, chemical dust, pesticides. Smokers, 60% are likely to be infertile compared to non-smokers. Causes of infertility for female exclusive: you have ovulation problems, immune infertility, uterine problems, endometriosis, tubal blockage, advanced maternal age, pelvic inflammatory disease, and age-related factor. So the cause can be acquired versus genetic and age, and also the usage of tobacco. For age, fertility peaks early to mid-20s, then declines after 35. Tobacco, nicotine interferes with estrogen for folliculogenesis and ovulation, which causes early onset of menopause by approximately 1 to 4 years. Body weight and eating disorders, either being underweight or overweight. Fat cells create estrogen. Immune infertility, presence of anti-sperm antibody. Diabetes mellitus causes increased risk. It causes delayed puberty, no periods, androgenism, and earlier menopause. By location: hypothalamic pituitary factors, it is hormone imbalance. Ovarian factors, anovulation, menopause or cancer. Tubal, ectopic, or peritoneal factors, endometriosis, adhesions and blockage. Uterine factors, fibroids, malformations, inflammation, implantation failure. Cervical factors, stenosis, chlamydia, antibodies, mucus. Vaginal factors, vaginismus, vaginal unnatural tightening, and obstruction. So these are the pictures of the uterine causes of infertility. Endometriosis, you can see the endometrium has thickened and is inflamed. And then you see chlamydia. Chlamydia causes a lot of injuries on the uterus, causing a lot of whitish tissue called adhesions. So all of these will twist and bend the fallopian tube in each and every way. And then you have chlamydia. Chlamydia causes the cervix to inflame, causing cervicitis. As you can see, the cervix has become bumpy and red, and also it will release a lot of discharge, which is yellow in color. For vaginismus, it means that the vagina is quite narrow, so it actually causes tightness and pain, or in other cases, penetration will be impossible. And then you have obstructions. Obstruction means that the vagina is blocked. So as you can see in the picture, you can see there is no opening at all. So it is totally blocked. There is no way for anything to come in and out. Causes of infertility in male: semen quality, low sperm number, testicular malformations, hormone imbalance, erectile dysfunction, anti-sperm antibodies, immotile sperm, blockage in the duct system. Other problems such as penis problems: you have lumps caused by ulcers, warts, Peyronie disease, which is hard scar tissue, and cancer. Priapism, which is a very painful erection that lasts 3 hours due to trapped blood. Prostate problems such as cancer, enlargement which constricts the ejaculatory duct, prostatitis, which is prostate inflammation, same as enlargement. So in terms of history, the term Priapism has its origin in reference to the Greek god Priapus, who was worshipped as a god of fertility and protector of horticulture. So this painting depicts Priapus weighing his phallus against a bag of coins. So as you can see, in groin injury with Priapism, usually Priapism will cause the blood to be trapped there. It cannot be escaping. So the blood will pool and it will be quite painful. These are the penile and urethral malformations. You can see the chordae, which is curvature of the penis. Some penises can actually be bent more than 30%. So at 40 and 50%, it is impossible for penetration. Hypospadia and epispadia. Hypospadia and epispadia is revolving on the hole or opening of the penis. Usually opening of the penis or urethra will be on the tip, but hypospadia, it opens below. Epispadia, it opens to the side. So it might make ejaculation much more difficult. And then you have urethral meatal stenosis. So just like the vaginal stenosis, the stenosis in the penis causes the hole to be much more smaller or narrowed. Usually it happens due to infant circumcision. Urethral stricture. So urethral stricture is a narrowing due to straddle injury. So straddle injury is an injury that happens from the repeated and excessive force to the groin. So either you are riding a horse, riding a motorcycle, riding a bicycle, or maybe you get kicked in the groin so hard that you have urethral stricture. So it's quite dangerous. And then you might also have this malformation called urethral valve. So valves are not supposed to be in that urethra. So urethra is supposed to be clear, but if you have a valve, it might disrupt the flow of anything going out, such as urine, such as semen. Other male problems: foreskin problems. This one can be solved by circumcision. You have balanitis. Balanitis is infection due to fungus or bacteria causing inflammation. Phimosis, or foreskin too tight to be pulled back to expose the head. So it means that sperm ejaculation is disrupted. Diagnosis for fertility testing. For women, you use a stretch test, in that you are checking the mucus, which are the liquid coming out of the cervix. Is it clear or is it sticky? Cervical position. Usually it is soft, high, open and wet during fertile period. Vessel temperature chart. So every day a woman would chart her temperature. Usually when temperature is high, it will be due to the progesterone release during menstrual cycle. So temperature will be released 0.5 to 1 Celsius. Pregnancy stick test. So it reacts against the LH and urine. If it has a bar, meaning that the woman is pregnant. And lastly, pap smear. So pap smear, It is the harvest of cells scraped from the cervix and examined under microscope to check for disease or other problems. So you can see there is a cell scraper being inserted into the vagina, and then it will scrape some of the cells on the cervix. So similar to getting your cheek cells, so you just have to scrape the surface a little bit, and then the cells will be spread onto a slide so that we can see if there is other diseases, there are other cells. Diagnosis for fertility testing. For one, we have direct fertility testing. So direct fertility testing means that you are directly measuring somebody's fertility. So you can find it using ovarian ultrasound. So using the ultrasound, you can actually find some eggs or follicles forming in the ovaries. Hysteroscopy. So you are putting an endoscope into the vagina to look into the uterus for fibroids or deformities. Laparoscopy. This one is much more invasive. You make a hole on the abdomen and then you insert the camera to view the inside of the abdomen. So this is laparoscopy. As you can see in this picture, the doctor has put two holes inside of the woman's abdomen, and bottom right will be the view from the camera. So what you can see there is an arm, which is laparoscopic arm, which is the arm that is used to manipulate the tissues that is within. So you can actually push the fat aside. Diagnosis of fertility testing. For men, it is a semen testing. Semen testing is needed so that you can find the sperm count, the motility of the sperm, the morphology, pH, volume, fructose, and acrosome. Organ inspection. The doctor or nurse will examine the penis, scrotum, testicles, vas efferents, ejaculative ducts, urethra, anus, and rectum for any deformities. Medical history. The doctor will look for any accident, infection, heat, radiation, sexual habits, and drug use that might influence the production of semen. Fertility testing for men. Continued. You have blood sample. In the blood sample, the doctor will detect the level of FSH and testosterone levels. Scrotal ultrasonography. In this case, you are doing ultrasound on your scrotum. So, ultrasound the testicles. It is done to detect internal problems such as blockage or torsion. Prostate exam. You have prostate checked by rectal exam, meaning that using a gloved finger, checking through the anus and physically feeling the prostate. So to prevent infertility for males, no smoking because smoking damages your DNA, no marijuana or alcohol, avoiding excessive heat to testes, wearing protective jock strap to protect testes during sports such as karate, hockey, and football, as you can see on the top right. Diet. Eat more Mediterranean diet, high omega-3 fatty acids and less in processed meat, soy, potatoes, and coffee. Physical activity. You must do more walking and exercising versus sitting or lying down. For female, you must maintain a healthy lifestyle, control your weight, balance your diet, and no alcohol or smoking. You must also have safe sex, using protection to reduce STDs. Regular physical examinations are needed to detect any early signs and abnormalities, and not delaying parenthood because fertility decreases with time. Egg freezing. You can freeze your eggs or oocytes so that you can be ready for use later in life. So, testicular self-examination. So, you must check it at least once a month. Perform the test in shower. So, you have to soak yourself up and check one testicle at a time and gently roll it between fingers. You must feel the spongy cords on the backside of the testicles and look for hard bumps, smooth or rounded bumps. Any change of size, shape or consistency must be noted. And any painful areas must also be noted because it might be any injury that might affect you. Treatments. Treatments for infertility. For men, you can have surgery if it causes varicocele or blockage. Antibiotics to treat infections in the reproductive organs. Medications and counseling to treat problems with erection or ejaculation. Hormone treatments if the problem is low or high level of certain hormones. In women, infertility is treated with fertility drugs and hormones to help the woman ovulate or restore levels of hormones. Surgery to remove tissue that is blocking fertility such as endometriosis or open blocked fallopian tubes. ART. ART or assisted reproductive technology. It is technology that is used to achieve pregnancy. used primarily for infertility treatments, aka fertility treatments, pill, reproductive endocrinology, and infertility. So, in ART, sexual intercourse is bypassed and fertilization occurs in laboratory. In vitro. In vitro means you let fertilization of sperm and egg occur outside the female body. Step 1. Transvaginal ovum retrieval. So in transvaginal ovum retrieval, you are getting a small needle into the back of the vagina and then guide it with ultrasound into the ovarian follicles to collect the fluid that contains the eggs. Step 2. Embryo transfer. One or several embryos are placed in the uterus of the female to establish a pregnancy. So, as you can see here, ovaries are stimulated, then eggs are retrieved, eggs are fertilized under a microscope, and then it will be cultured into the petri dish. After that, an embryo will be freezed, and then one of the embryo which is viable will be transferred into the womb, and then after 14 days after ET, you test for pregnancy. Other alternate IVF techniques. You have ICSI, intracytoplasmic sperm injection. It is done when sperm counts are low or failed fertilization occurred with the previous trial. It involves a single sperm injected into the center of the egg using a microneedle. Zygote intrafallopian transfer, or ZIFT. Egg cells are removed from the woman's ovaries and fertilized in the laboratory. The resulting zygote are then placed into a fallopian tube. Cytoplasmic transfer. Contents of a fertile egg from a donor are injected into the infertile egg into the patient along with the sperm. Gamete intrafallopian transfer, or GIFT. It is a mixture of sperm and eggs placed directly into a woman's fallopian tube during laparoscopy following a transvaginal ovum retrieval. ICSI, as you can see, you're breaking the sperm tail and then you place the sperm near the egg membrane, injecting the sperm into the egg and removing the ICSI needle. With GIFT, sperm and eggs are placed into the fallopian tube to allow fertilization in natural site. So the woman must have at least one normal open fallopian tube. In ZIFT, you take the eggs and then you put it outside in the sperm sample, and then when you have the fertilized embryo, you put it back into the fallopian tube. Risk: increased birth defects. 6.2% of IVF conceived children has major defects compared to 4.4% of naturally conceived children matched for maternal age and other factors. Heterotopic pregnancy, which is simultaneous intrauterine and extrauterine pregnancy, means that you have babies inside and outside of the uterus at the same time. Risk is higher from sperm donation. 35% will have a defect. Genetic disorder, low birth weight, preterm birth, and also low birth weight. Children born after IVF are roughly twice as likely to have cerebral palsy. Contraception. Contraception is a method or device used to prevent pregnancy and stop sexually transmitted diseases. Contraception tries to stop pregnancy by keeping the egg and sperm apart, or by stopping egg production, or by stopping combined sperm and egg, fertilized egg, attaching to the lining of the womb. Monogamous relationships would use contraception simply as a means of birth control, while individuals with more than one sexual partner will also be concerned about getting an STI. The history of contraception: 1850 BC in Egypt, honey and acacia leaves and lint are placed in the vagina to block the sperm. Lactation are also known to stop any pregnancy. In medieval Europe, inserting lily root and rue into the vagina, tied with a testicle around thighs during sex, would be the preferred way for contraception. In the Renaissance, they used condoms made of animal guts. So the famous womanizer Casanova, who slept with more than 1,000 women, he used lamb skin. So in China, India and early Islam, the one that is used are coitus interrupters and pessaries to block the cervix. So pessaries are made out of elephant dung, cabbages and pitch. Types of contraception: you have long-acting reversible contraception such as the implant or intrauterine device, and then you have hormonal contraception such as the pill or Depo-Provera injection, and then barrier methods such as condoms, and then emergency contraception, fertility awareness, hormonal contraception such as vasectomy and tubal ligation, and behavioral methods. So, long-lasting reversible contraception or IUDs. They last for a long time. The IUD would last 5 to 10 years. Implant would last to 3 to 5 years. It will stop the sperm from reaching the egg. It is the most effective type of contraception, 99% effective at preventing pregnancy. There are two types, one with hormones and one without hormones. They are using copper. Implants, they are implanted into skin. They are usually rods the size of a matchstick. They slowly release a hormone called progesterone. It can stop your body from releasing an egg each month. It will thicken the mucus in your cervix so sperm cannot get to an egg. It works up to 5 years but do not protect against STDs. Hormonal contraception. The pills injections which manipulate hormone levels to ensure infertility. There are two types of pill: combined oral contraceptive pill and progesterone only contraceptive pill. So one pill each day will be more than 9% effective at preventing pregnancy if taken correctly. Depo-provera, it is an injection containing progesterone every 3 months. Pregnancy by stopping the ovaries releasing an egg each month. Other types of hormonal contraceptions, you have the birth control patch. Transdermal contraceptive patch contains the hormones estrogen and progesterone, goes to the skin. Vaginal ring or nuva ring, it is a contraceptive ring which sits inside the vagina containing estrogen and progesterone. So despite looking like a bangle, it is not meant to be worn as a bangle. Barrier methods. Barrier methods stop sperm from entering the vagina physically. Male and female condoms, cervical caps, diaphragms, and contraceptive sponges with spermicide. Commonly used, inexpensive, and also stops STD. Latex, nitrile like gloves, and polyurethane like bottles are the common materials to make the barriers. The male condoms can only be put on when erect, but it might tear due to intense intercourse. Barrier methods of birth control. You have the sponge. The sponge will be a sponge that is impregnated with anti-spermicide and then put into cervix. Then you have the male condom. Then you have the diaphragm. It covers the cervix. Female condom will be similar to the man. They have the cervical cap. It is a small cap that covers the cervix. So this is a case that happened in Vietnam. So the Vietnamese couple who are young, both of them, they are too embarrassed to buy condom. So the boy uses the plastic bag and then he puts it on his penis, and due to sex with the plastic bag as condom, both of them were left with serious injuries. If you look at this news article, it says that as the plastic bag was rough and lacked elasticity and lubrication, the young couple ended up scratching their genitals to the point of bleeding, said the paper. So both of these youngsters were college undergrads. Emergency contraception. This one are used after unprotected sex. They are having high estrogen instead of the pills. It stops and delays egg release until sperm inactive. It prevents the sperm from fertilizing an egg by changing the way the sperm moves. Once the egg is fertilized, it is not working anymore. It doesn't harm you or a developing embryo. It can be taken up to 72 hours after sex, which is 3 days. IUDs can be used up to 5 days after sex. FAM, Fertility Awareness Method. It requires a woman to monitor her body to determine when she is most fertile. It is to avoid having unprotected sex around the time of ovulation. It involves paying attention to different bodily changes such as basal body temperature or cervical mucus and recording them to predict when you will ovulate. Record and check fertility signs, then must agree to not have sex or to use backup birth control for 7 days before and 2 days after ovulation. Billings method, also referred as the ovulation method or cervical mucus method. So cervical mucus will change around the menstrual cycle. It becomes clear and lasts about 6 days prior to ovulation due to influence of estrogen. And ovulation is likely to occur on last day that the cervical mucus shows these properties. After ovulation, the cervical mucus is affected by progesterone and becomes thick, sticky, and opaque. Saturday method (FAM). Couples must abstain or use condoms or backup birth control during your most fertile days of each month. Avoid unprotected sex from day 8 to day 19 of your cycle, a total of 12 days. Relies on strong couple communication, meaning that both have to be honest and track their fertile days and abstain. Symptothermal method. Symptothermal method is a basal body temperature and cervical secretions and other fertility signs. With all of these signs, you can identify the fertile and non-fertile days by combining body temperature and ovulation method instructions. Other signs of fertility, for example, breast tenderness and ovulatory pain, which is lower abdominal pain or cramping during time of ovulation. And to avoid unprotected sex between first day of period and the fourth day after peak cervical secretions, or the third full day after the rise in temperature, whichever happens later. So both of the couple must share responsibility for keeping track of cycles and knowing when it is the fertile period. As you can see, this chart tracks temperature, which is height, and cervical mucus, which is color. So you can see the red is heavy, and then it goes lighter to become medium and light, and then becomes nothing, and then sticky, egg watery, creamy, and egg white. So if you can see, between the day 16 to 22, you can see that the mucus is sticky and there will be a high temperature. So both peak day and temperature shift rule are satisfied, meaning that it is quite fertile during this time. Permanent sterilization. Permanent sterilization will prevent all future pregnancies. For males, it is vasectomy, and for female, it is tubal ligation. There are no significant long-term side effects, and tubal ligation decreases the risk of ovarian cancer. 5% of over 30 women experience regret compared to 20% of under 30 years old. Ovum and sperm can still be extracted, and there is no protection against STDs. Tubal ligation, or in regular words, having one tube size. The fallopian tubes are closed. It involves a general anesthetic and a laparotomy or laparoscopic approach to cut, clip, or cauterize the fallopian tubes. Other methods use clips or rings to clamp them shut, or severing or cauterizing them. 90% effective for the first year, but it might reduce due to tubes healing or reconnecting. Vasectomy or vasoligation. Vasa deferentia, the tubes that connect the testicle to the prostate, are cut and closed. Prevents sperm produced in testicle from entering the ejaculated sperm, which is mostly produced in the seminal vesicle of the prostate. So a man can still ejaculate, but sperm which are still produced in testicles, they will be soon broken down and absorbed by the body because they cannot escape. Within 1 year, 60 to 70% of vasectomized men would develop anti-sperm antibodies. Hysterectomy. Uterus is surgically removed, permanently preventing pregnancy and some diseases such as uterine cancer. Total, removing the body, fundus and cervix or uterus, often called complete, or partial, removal of uterine body while leaving the cervix intact, also called supracervical. It renders the patient unable to bear children, may cause the menopause-like symptoms due to hormone imbalance. Castration or gonadectomy. It is in males. Testicles are surgically removed, frequently used for the sterilization of animals but rarely for humans. Commonly used on children for other reasons such as the castrato and the eunuch. So castrato are these singers in the church, in the choir. To maintain the angelic voice that they have, they are allowed to become adults or become teenagers, because you know, when you are a teenager, your voice cracks. So for the church to make sure that their voice will still stay angelic and not break, so they would castrate them. So even at the age of 13, 14, 15, they still have the angelic woman-like voice. Surgically or bilateral occlutomy. Occlutomy means excision of both testes. And chemical. For chemical, you have pharmaceutical drugs to inactivate the testes. So by removing the testes, the production of testosterone would also be decreased, when the testosterone is decreased, it means that the person will be much more effeminate and less masculine. In ancient China and Korea, castrated men were royal officials, so they are usually hanging out in the palace, advising the king, but at the same time the king or emperor does not want them to mess with the concubines or creating illegitimate children, so that's why they are castrated, and they are used as punishment to sex offenders. Transluminal. So for transluminal, it is the usage of catheter to place substance into the fallopian tubes that eventually causes the blockage of tract in the segment. So it looks like a spring. It is called the micro insert. So it is put in the fallopian tube, and by irritating the fallopian tube, it will cause blockage. So action procedure using polyethylene terephthalate pipocol, they are placed in the fallopian tube, inducing scarring and occlusion of the tubes. Quinacrine procedure, you put quinacrine pellets into the cervix of a woman's uterine cavity, causing the scarring to close off the fallopian tube from the uterus. Behavioral method. Regulating timing or methods of intercourse to prevent introduction of sperm into the female reproductive tract, either together or when the egg may be present. So it involves withdrawal or coitus, ending intercourse before ejaculation. Abstinence, not engaging in any type of sexual activity or vaginal intercourse, or breastfeeding. Breastfeeding can actually cause amenorrhea. Lactation amenorrhea, which is breastfeeding, can increase infertility after birth. So the most effective of birth control from best to worst. Sterilization is the best, vasectomy in males, interval ligation in females. Second will be intrauterine devices and implantable birth control. Next will be hormone-based methods using oral pills, patches, vaginal rings, and injections. And then physical barriers such as condoms, diaphragms, and birth control sponges, and fertility awareness methods. And lastly, spermicides and withdrawal by the male before ejaculation. So to increase effectiveness, both of these must be used as a dual protection, meaning that you are actually using two methods altogether or any combination. It will actually make the effectiveness increase. Effects of contraceptive use. It has decreased the number of maternal deaths by 40% due to reduced number of unplanned pregnancies. It improves child survival in the developing world by lengthening the time between pregnancies. It also increased the economic growth due to there being fewer dependent children and thus more women participating in or increased contribution to the workforce. So these are the worldwide maternal mortality. Areas in red would be areas with high mortality during birth, meaning that the mother would die during the birth because of lack of hygiene and lack of access to healthcare system. And the green areas will be the areas with low maternal mortality. As you can see, most of the red colored areas are in the poorer countries, third world countries. As you can see, India has it, Africa has a lot. Their color is much more redder. South America is usually the yellow zone, mean that they are not too high, not too low, they are in medium zone. In Asia, it is much more the yellow-green zone, meaning that you have around 30 deaths per 100,000 live births. Japan, Australia, Europe, America, all of these are green countries. So green countries, they have very low deaths per 100,000 live births. This is the countries by fertility rates. So the country with purple, they have the most number of children per woman, and the countries which are blue, they have the less number of children per woman. As you can see, in America, the number is 1 to 2. Other than that, you can see Greenland, Brazil, Australia, China. Because China, it is instituted by the government. The government does not allow the children to be more than one per family. In Japan, it is usually due to late marriage and lack of preference in marriage in general, so they would not have a lot of children. The cost will be quite high. If you look at our country is in the green zone, meaning that every woman would have an average of 2 to 3 children. But Philippines, they are much more than us, 3 to 4 children per woman. The end.